Welcome to Floor Talk. It's wonderful to have you on the show.
Well, thank you for having me.
My pleasure. So, Sach, tell me, what problem in healthcare inspired you to start Carrum Health?
Yeah, I started in healthcare 15 years ago, working for a hospital rev cycle company. And I realized that the biggest challenge in our healthcare system is how we pay for healthcare under the fee-for-service payment model. God forbid if you have back pain and you're recommended a procedure. Today, it's a very frustrating experience. You don't know whether you can truly trust the doctor, whether you will actually benefit from this procedure, how much will it cost, what the process will be. And then the bills will start coming in your mail, and they will keep coming. That's the word of fee-for-service PPO networks, where no one is accountable for the cost and quality of care that is being delivered and the member experience. So it's not a surprise that our healthcare spend is a runaway cost, growing at 8 to 10% year over year, when the rest of the economy is growing at 2 to 3%.
So you talk about healthcare costs rising. Now, Warren Buffett actually calls healthcare the tapeworm on the American economy. So how is Carrum Health addressing this issue?
We launched Carrum Health in 2014 to build a value-based care alternative to PPO networks, starting with specialty care. We start with quality, and our platform matches a patient with a top 10% provider in our network we call as centers of excellence, who do a procedure only when it is necessary, and they have best-in-class outcomes. We have this pre-negotiated bundle payment contracts with the providers that bring the cost down on these procedures by almost half. So as a member, you don't have to worry about the quality, the cost, the bills, the process. You can focus on getting healthier as opposed to fighting the healthcare system. This is how healthcare should be, and we're making that possible for millions of members working for public and private sector employers through our partnerships with over 1,000 centers of excellence, which include the likes of Mayo Clinic, Cleveland Clinic, Hospital for Special Surgery, just to name a few.
Now, Sach, you mentioned that you started the company with a focus on specialty care. So why focus on specialty care, and what impact have you made?
Specialty care is where the PPO model is most broken and the patient experience is the worst. It is also accounting for nearly half of the total healthcare spend. For employers who are our clients, this spend is growing at nearly 14% this year, far outpacing the rest of the healthcare spend. And hence, it's a big focus area for employers. What impact have we made? So Rand Corporation conducted a peer-reviewed study on Carrum that was published in Health Affairs. And what they found was when employers implemented Carrum, we helped avoid 30% of unnecessary procedures, brought the unit cost down by 45%, and readmission complications rate by 80%. You combine that with a patient NPS score of over 80, it tells you what wonders our healthcare system can do if it is set up correctly.
Now, as the company celebrates 10 years, tell me, how has it grown, and where do you see it in the next decade?
We believe value-based care adoption is a multi-decade change like e-commerce. Instead of doing a big bang, we are building this model specialty by specialty, starting with low-hanging fruits like musculoskeletal, bariatrics, and cardiovascular procedures. Starting this year, for the first time, we'll be covering nearly the entire span of specialty care. We're also getting a lot of interest from incumbents like health plans and have partnerships with companies like CVS, and we are part of the Hub program of United. Over the next decade, we expect this model to largely replace PPO networks for specialty care and be accessible to anyone, anywhere in the country who need any kind of procedure, whether they are covered by an employer, a commercial health plan, or a Medicare Advantage plan. That's the dream.
Well, Sach, it's been wonderful to talk with you.
Thank you
for joining me on Floor Talk today.
Thank you for having me here.